Hey guys, JD Zuma here at the Movement University. Today we're going to work on a few strategies to deal with cranky hip flexors. So for those of you who may not even know what a hip flexor is, these are any muscles that cross the front of the hip socket, the front of the hip joint, and allow us to lift the leg forward, flexing the hip. So muscles like the psoas, the iliacus, the rectus femoris, muscles in this region are the ones that we're going to be targeting here. And what happens is when we spend a lot of time sitting throughout our day, whether you're commuting to work in a car or if you're sitting at your desk working on the computer all day, whatever it is that you do, these muscles can get really short and tight and can inhibit the function of the muscles on the backside there. So it's really important to get them loose. I'm going to show you a few strategies for what you can do in the gym and at home if you have the right equipment. All right? So this strategy we're going to show you here is something we've adapted from what we have here in the garage. But the best thing is if you have a kettlebell or a dumbbell that has a small end to it, not the really big dumbbells, but maybe something that's about 2 or 3 inches in diameter. You want to get that pressure just on the inside of your hip bone, okay? Now, there's a few different areas you can target, and I'll talk you through them. The most important thing is finding the ones that are uncomfortable. Those are the ones that you probably need to be working on. So this is about a 15-pound instrument here, and the ball is at the end of it. So I'm just letting the weight of the tool do the work. And you can do it with your knee bent if that's a little more comfortable, and if you're ready to move the leg out, you can do it with the leg straight. And I'm just fishing around along the inside of that hip bone to try and find a tender spot. And when I find it, I'm going to just let the weight just kind of rest on there. I might rotate my leg in and out to expose a different part of it. But the most important thing is I'm really just letting that muscle soften and relax because it's in spasm, meaning it's very tight and restricted. So I'll spend a little bit of time here. We usually recommend anywhere from around 90 seconds or up to 2 minutes to really let that muscle release. And then, you can also fish around a little bit more close to the belly button. Like basically, if you drew a line from your belly button to that hip bone in the front, right in the middle there is where you're going to land on the psoas. And this can be pretty uncomfortable, so just kind of breathing and relaxing your belly through it. The other one you can do, again with a dumbbell or any kind of weight, is taking that weight and just letting it rest on just below the hip bone. So now we're getting towards what we would call the top of the thigh. And I'm just going to gently rock that bar. You can do this with a bar too if you have a bar at your house or in the gym. And just gently rolling it back and forth to get some pressure through that other hip flexor muscle. Now, for this particular area just below the hip bone, I also like to have people use the foam roller. So you can lie the foam roller down just like this. And I'm going to get my body weight right over the top of it, just below that hip bone. So this is my hip bone right here. I'm putting my weight right on top of it, and I'm rolling my weight a little bit more to that side so that my body weight is pressing into that muscle there. And again, I'm just fishing around for that sticky, uncomfortable spot, spending 90 seconds to up to 2 minutes on that spot, really letting it release and loosen. And then I'm going to look around and see if there's anything else there. For this one, I also like to roll over to the side, where this would be more the TFL muscle, the tensor fasciae lata. Sometimes we call it the pocket muscle, because it's like the muscle that's right where that front pocket of your pants would be, over here just a little bit off to the side. And all these muscles can cause restriction in that area of the body. So spend the 90 seconds up to 2 minutes working on those muscles. After you do that, make sure you're doing some activation of the glutes and the muscles that are opposite so that you start to rebalance the joint. If you have any questions, please leave some comments below, engage with us, we'd be happy to help you out.